Hello, thank you all for joining. My name is Robin Holland, and I am very pleased to be with you today to review two recent studies on the evaluation of oral fluids as a sample type for the detection of African swine fever virus. For ASF diagnostic testing, the currently approved sample types include whole blood for antemortem and spleen, lymph node, and tonsils for postmortem virus detection, and serum for serological testing. What is valuable about these sample types is that they are very well characterized for viral distribution and widely used throughout the World Organization for Animal Health Reference Laboratories and are thus considered the gold standard for the diagnosis of ASF. However, it is recognized that these sample types are not without their challenges. So, for example, collection of whole blood requires trained animal health personnel, often with multiple individuals working together to restrain an animal for sample collection, and the sampling itself is limited to individual animals. Therefore, there has been considerable interest from industry partners to evaluate additional sample types that address the challenges currently encountered in ASF testing. A primary sample type that has garnered interest for ASF testing are oral fluids, which are comprised of saliva and oral mucosal transudate that are collected by hanging a rope in a pen and allowing pigs to chew on the ropes for approximately 30 minutes. Oral fluids are especially valuable given they are relatively easy to collect without the requirement of specialized training for animal health personnel. And furthermore, oral fluids are considered an aggregate sample type and thus provide testing of multiple animals in a single sample collected and have been successfully used for surveillance testing of various endemic diseases of swine. So, why are oral fluids not being used for African swine fever testing? Unfortunately, due to challenges related to studying foreign animal diseases that are also regulated as select agents, there is a lack of rigorous field-based studies on oral fluids as a sample type for ASF. In light of the expressed value that oral fluids will confer to industry partners in swine health monitoring programs, two studies were sought towards the evaluation of oral fluids as a sample type for ASF, focused from the perspective of the laboratory and the field. To start, we'll discuss a laboratory-based study that was published last year in the evaluation of the feasibility of oral fluids for the early detection of African swine fever virus. The study was conducted through partnership of two laboratories, including the National Center for Foreign Animal Diseases in the Canadian Food Inspection Agency in Winnipeg, Canada, and the National Veterinary Services Laboratories Foreign Animal Disease Diagnostic Laboratory at the Plum Island Animal Disease Center. For experimental design, the study involved the inoculation of a cedar pig with either one of two strains of ASF. At CFIA in Canada, African swine fever virus Georgia 2007 was used, which is a highly virulent strain of ASF. At the Foreign Animal Disease Diagnostic Lab at Plum Island, African swine fever virus Malta 78 was used, which is a moderately virulent strain of ASF. After inoculation of the cedar pig, the pig was then introduced to a group of naive animals. The group was monitored for several weeks, including daily assessments for clinical scores and body temperature and daily collections of oral fluids and alternating days of whole blood collection. Here are two experiments performed, the left graph being clinical parameters of animals from the inoculation study with the Georgia strain, and the right graph being the Malta strain. In red and yellow are the respective clinical scores and rectal temperature of the cedar pig that was directly inoculated with ASF. The cedar pigs developed clinical signs within a matter of days, and by day 7, the cedar pig died that was infected with the Georgia strain, and by day 10, the cedar pig died that was infected with the Malta strain, as expected. Here in blue and green are the clinical scores and rectal temperature of the naive contact animals, which developed clinical signs several days after exposure to the cedar pig, demonstrating disease transmission. And here are the same two experiments with data from African swine fever virus detection by PCR in collected samples. First in yellow are the cedar pig's whole blood samples. A friendly reminder that the lower the CT value means the more virus that is present. African swine fever virus Georgia and Malta were detected 2 to 3 days in the cedar pig after inoculation. And here in blue are also whole blood detections of African swine fever virus, and these are the data from the naive contact animals. These data demonstrate that indeed the cedar pigs transferred ASF to the contact pigs, and the time from contact to ASF detection was approximately 8 to 10 days. And lastly, here in red are the oral fluids data. Please keep in mind that these data are indeed from an aggregate sample type from all of the animals in the pen. And from the oral fluids, ASF was detected 3 to 5 days after infection of the cedar pig. And although CT values were relatively high compared to the whole blood samples, all samples were below the PCR detection cutoff. So in summary, here are the comparative data of the mortality and initial ASF PCR detection data. So after inoculation of the cedar pig, ASF was detected in the blood within 1 to 3 days, in oral fluids within 3 to 5 days, and within 6 to 10 days in the contact pigs. These data demonstrate the temporal relationship between different sampling methods in the cedar versus contact pigs, suggesting the potential utility in ASF detection. So in conclusion, the results in the study suggest that oral fluids may be used to supplement the use of whole blood in the detection of ASF in surveillance efforts. So this study provided important laboratory-based data on the characterization of oral fluids as a sample type for ASF. And next, we will discuss a new unpublished study in the field performance of oral fluids for ASF detection. For partnering institutions, this work was conducted by a multidisciplinary and collaborative team, including NBSL FADL at Plum Island, as well as the National Animal Health Laboratory Network, the National Pork Board, the Centers for Epidemiology and Animal Health, Carthage Veterinary Services, and the University of Agricultural Science and Veterinary Medicine in Romania. Because of the need to evaluate the functionality of oral fluids in an ASF outbreak setting, a collaboration was established with Romania, which has been involved in an ASF outbreak since 2017. For this study, 3 farms were identified for participation. Sampling strategies were identified, and after collection at a single time point, the samples were frozen and sent from Romania to FADL for ASF PCR testing. And note that not all pens on a given farm were tested, and within pens there was incomplete sampling. And it is important to remember that these samples collected were from real farms in the midst of a real ASF outbreak. Therefore, this study could not be designed to meet all of the requirements of a full validation study, and that there will be limitations in the interpretations of results due to the biological and infrastructure variability. So any results must be interpreted within the context of that environment of which the samples were collected. So here are the blood collection rates per pen of the 3 different farms. While there were some pens where blood was collected from more than 90% of the animals, many more had much lower rates of blood collections from those animals. And here are the apparent ASF prevalence data per pen based on blood PCR for ASF. Nearly all of the farms, most pens had 0% prevalence of ASF, with other pens yielding variable prevalence percentages. And here is a breakdown of pens that tested positive or negative for ASF in both or either blood and oral fluids. By and large, there was excellent agreement between both sample types, with ASF not being detected or being detected in both oral fluids and whole blood. However, there are some discrepancies, with some pens testing positive for ASF in blood, but not in oral fluids, or vice versa, with ASF testing positive in oral fluids, but not in blood. So here it is important to remember that environmental context for which these samples were collected. It is difficult to interpret oral fluids data when there is incomplete whole blood sampling. So furthermore, these data are also at the pen level, but because of incomplete biosecurity between pen, any one individual pen cannot really be considered independent of an entire barn. Pulling all of the data together, relative diagnostic sensitivity estimates were conducted. Because there was not 100% collection of the gold standard sample of whole blood, we must note that these sensitivity measures are relative between the sampling process within the study, and are not reflective of the true diagnostic sensitivity. In evaluating all pens, the relative diagnostic sensitivity for whole blood was 0.85 and oral fluids was 0.94. And when evaluating only pens with at least 35% of the animals sampled, the relative diagnostic sensitivities increased to 0.95 and 1.0 for blood and oral fluids respectively, with overall no significant difference between the sample testing processes. Taking a few steps back of what is needed for a full validation study, it is important to remember that it is the job of the USDA Veterinary Services to quantify the probability of a false diagnosis as a key element in assessing risk. In an ideal validation study, pen sizes should be wider in distribution with more variable ASF prevalence, and having that gold standard sample type as the basis of comparison. For this study, it was observed that farms had a more limited window of pen sizes, with overall lower ASF prevalence, with very few pens where oral fluids being collected with 100% sampling included. Therefore, for future studies to be conducted, modifications to sampling strategies on farms included will provide important information in efforts towards validating oral fluids as a sample type for ASF. So for today, we have covered two important studies in the evaluation of oral fluids for ASF detection from two different perspectives from the laboratory and the field. This first study is available online if you would like to learn more, and the second study is pending additional review and analysis. So in conclusion, oral fluids are promising as a sample type for ASF testing, and specific use cases for oral fluid sampling for ASF must be defined and clearly communicated. For future studies, it is important to assure that the gold standard sample test is achieved so the requisites for a full validation study are met. And lastly, it is important to perform studies on farms with larger pen sizes, which are more representative of facilities present within the United States. So I hope today has been helpful in reviewing these two studies on oral fluids for ASF detection. APHIS is committed to safeguarding health, welfare, and value of American agriculture and natural resources, and Veterinary Services is committed to modernizing core animal health services to assure that they are efficient, fiscally responsible, and optimized to address current animal health concerns while minimizing negative impacts to industry viability. So thank you.